everyone, it's Caroline here, and I'm just doing this update. Haven't updated in a while, so thought I would do this update now. So let me think. I have been having a hard enough week. There's been some trigger dates to do with ritual abuse, and just it's been a hard couple of days. Tuesday and Wednesday were really hard because they're both holiday dates. So first of all, I didn't go to therapy on Monday. I couldn't. We had a very hard discussion last week. Some of you may have heard some of it because I had it recorded. But we had a discussion around emotions, and basically there was a lot of sadness coming up for me that I couldn't put into words. And it was very challenging, to allow myself to be vulnerable, to allow the system to expose ourselves and our emotions that way, even though, we're really close with Eileen, our therapist, and we are very attached to her and we trust her. We would trust her with our life basically, but still, it's still very hard to be vulnerable and to allow the emotions to come out and allow tears and stuff. We haven't actually ever cried in front of her. So after therapy then last week, that whole, after all bringing up of emotions and everything, the few days after that, it was very challenging and I was very anxious and the emotions were coming up a lot more, and I felt like I needed to protect myself because I've had some bad experiences in the past with therapists, and previous therapists haven't been good for us, and they've had very bad boundaries. Now Eileen doesn't have any of that, but every so often this comes up. So Monday came and our appointment was for 3 o'clock, and I spent all morning being anxious and making myself physically ill. So then I texted Eileen about 2 o'clock and I said, look, I'm not coming in, I don't feel well. And she didn't push it. She texted me back and she said, okay, take care, see you next week. And then I felt bad because I hadn't told her the truth, and so I wanted to text her that night and I didn't, and then the trigger dates happened and I was just all over the place. So Wednesday, I texted her Wednesday and I told her the truth. I said, look, I was really feeling overwhelmed and fragile and I need to talk to you, and text me back when you get a chance. And she did, of course, text me back, and we set up a time to talk and we had a good chat, and it was really good to talk to her and to be able to put words on my experience. She congratulated me and told me she was really proud of me and that she understood, and I told her, I thanked her for not pushing me and for not saying that I had to go to therapy, when I didn't feel up to it. And she said that that wasn't the right thing to do and she'd never do that. So that's one thing that's been going on. So we'd had all that. So I had no therapy this week, but I did see Dr. Barry, and Dr. Barry and me are sorting out, because I'm going to be doing a case conference. Basically, it means that it's done in the hospital every week on a Friday morning. In the hospital, there's case conference, and they pick a tough case, like a very a case that's not easy, straightforward, and they pick one and they have a conference about it, and then they have a presentation. All the doctors and the nurses and psychologists and social workers and stuff. So they have a conference and then they have a presentation, and then they have questions and answers where the doctors discuss treatment options and outcomes and things. Usually the patients aren't involved, but Dr. Barry has asked me would I like to do it. So I said yes, of course I'd like to educate the doctors on DID. And so many times when I've been in hospital before, junior doctors have saw me and asked me tons of questions about my diagnosis. And that's okay, but it does get kind of wearing after a while because the same questions all the time, and they're not very good questions. They're kind of like, fascination more than, education. So Dr. Barry has asked me to do this case conference. Well, I brought it up to her when I was inpatient a few weeks ago, and she said, yeah, okay, we'll do that. And so in about 3 weeks' time, I'm going to do it. And basically, what happens is I will go into a room, and Dr. Barry's junior doctor on the team will ask me some questions, set out questions. I'll know what they are in advance, and there'll be a video camera, and I'll be videoed, and it will be linked into the other room where all the rest of the doctors and nurses and people are, and that's how it goes. So I'm pretty excited about it. Actually, I've done one a couple of years ago, maybe back in 2007, but I did one as well, but I was less experienced then. I'm a lot more experienced now and a lot more versed in my diagnosis, and would have a lot more to say about things. So I'll leave this video for now, and I'll make another video because I have some more things to discuss. So I will make another video soon. Okay, thanks guys.
6 minutes, 22